Hi, my name is John Shaw. I'm the Director of AI for Healthcare at System C. And this is a great opportunity to tell you a bit about what we're doing with AI in healthcare, the why, the what, and the where. So there are three principles that sit underneath everything we do here at System C for AI. The first is that we want this to be purposeful innovation. So we will only build something that solves a real problem or delivers real time saving. It's very easy to have great ideas around what you could do with AI in healthcare. But it's really important that when you scratch underneath some of those ideas, you ask yourself, are they substantially making healthcare organisations more efficient? Are they saving them cost? And are they impacting patient outcomes and improving clinician working lives? And if you don't have answers to those, then you shouldn't be doing AI. And so we don't want to do AI for AI's sake. And that's something that many healthcare suppliers will be tempted into, and we're not going to play that game. So the second principle is ethical by design. It's really important with AI that it's safe, it's transparent, and it's trustworthy. We have built AI from the beginning to be medically device compliant, conform to the clinical safety requirements. And so the third principle is human first. We want AI to empower people, not replace them, but help them do more of what they can do best. And so that means moving that computer screen out the way, moving the EPR out the way, getting AI to do the donkey work, if you like, and putting the clinician back in front of the patient. And so as an organisation, you're going to get better patient experience, improved clinician satisfaction, but ultimately better patient outcomes. So that's a bit about the why. What about the how? Well, the technological building blocks of what we're doing here at System C consist of two technical pillars. The first is voice technology. And that is capturing the conversation that takes place between the clinician and patient. And when you think about it, that conversation is the seed event for everything else that happens downstream in the clinical and healthcare workflow. The second pillar really is the EPR context. So the conversation alone is useful, but actually if you can add in the patient history, it becomes even more powerful. And when I say patient history, if we think about the previous letters, the previous attendances, the recent results, the current medications, the problem and diagnosis, all of that rich information, it doesn't just improve the ability to correctly summarise what's going on with the patient and write a letter, but actually it's fundamental to the decision support that you need to improve patient safety and patient outcomes. So those are the two principles, and alongside them we've got 5 core skills. That's summarisation, coding, actioning, clinical decision support, and insights. And each one of those skills is cumulative. So it's a layer that builds on the previous layer. So if you take summarisation, you need to take that conversation, that transcript, condense it down to the relevant pertinent information, generate semi-structured data. But then the step beyond that is to label it and create more structured data, to code it. But once you've got that labelled data, you can identify the actions, the orders, the tasks, even the prescriptions that are needed. And then once you've identified those actions, well, then you can provide the clinical decision support. Is that order, is that prescription safe? Can we prompt to think about other things? What hasn't been discussed, what hasn't been considered? And then the aggregate of all of that is insight. So using artificial intelligence to figure out and predict what might happen next to the patient or what needs to happen next. That's not just at patient level, but at population level too. And so what's really interesting is each layer draws more deeply on the EPR than the previous layer. And so hopefully what you can see is that having the ambient AI inside the system of record, we think is a much more durable solution for AI than if you bolted on some third-party system from the outside. So I've talked about the why and the what. What about the where? Well, you think about those technical building blocks I've just described and those 5 core skills, you can apply them across the whole of healthcare. So the breadth that we can address is huge, from outpatients through to inpatients, emergency care, maternity, neonatal, oncology, pharmacy. All of the workflows benefit from those 2 technical pillars and those 5 core skills.